So let us begin with remedy Agnus castus. Just a minute, there is. Okay, so let us begin with the remedy Agnus castus. The first line that is written in Allen's keynotes is that it is for the lymphatic constitution. Now, we have already read so many remedies that have specific action on the lymphatic region, and it is important to note all these remedies because these remedies are going to help you clear all the cases which are stuck up with drainage of impurities from the system. So Agnus castus is one of them. We read in Thuja, it can be Medorinum. In fact, if you see very closely, the remedies which are psychotic in nature are mostly acting on the lymphatic constitution and will help in drainage of the lymph very easily. This will make your job easier whenever there is a patient with some glandular affection with very hardened glands, or there is discharge which is stuck up which should actually come out. Those remedies which are acting on the lymphatic constitution or act in the drainage of lymph will help clear the case. So Agnus castus is one of the remedies which will act in that way. In mental journals, we have absent minded, reduced power of insight, cannot recollect, has to read a sentence twice before he can comprehend. So, the physical body has weakened the mind so much that he cannot understand what is told and he takes time to register. In Helleborus, it is due to the cerebral inflammation and the inactivity of the brain which needs to be active. In Agnus castus, it is more of because of the excessive physical body wastage, it has affected the mind. So Whenever you tell anything, they take time to register. When they read something, they take time to understand. The other remedies mentioned are lyco, phosphoric acid, and sepia. The next line says that it is suited to people with premature old age. Now we saw so many remedies so far in the entire alien keynotes in the last 3 months, which have premature old age mentioned many times. For example, lyco, ethusa, sanicula, and so many other remedies. In fact, it's also Baraitaka. I don't know whether it's written or not. I don't remember exactly. But if you find it from the other books, you will find it that there is premature old age. So these remedies are going to help you understand the patient's age, and if it is, some age which the patient tells you, but he already looks like he is more than what his age is, he looks more older than what his age is, then you can prescribe these remedies. In Agnus castus, we see there is melancholy, apathy, mental distraction, self contempt arising in youth persons from sexual abuse of sexual powers from seminal losses. Then you have old sinners with impotence and gleet, unmarried persons suffering from nervous debility. So you have people who are not married can be given these remedy, especially males. Females will require conayam, and in fact you will also require agnus castus with medorinum. So there is bad effects from suppressed gonorrhea mentioned. Complaints from imaginary odor before the nose as of a herring or musk. Prevents excoriation from walking. I don't know how this symptom would mean in clinic, but we'll have to find out from the source books. In the male sexual system, we see there is complete impotence, relaxation, flaccidity, coldness of genitalia, no sexual power or desire. This is similar to caladium and selenium. So many times patients will tell you that the desire is good, that the strength is good, that the ejaculation is good, or there are variations in one or the other levels of expression of their sexual desire or male sexual system. Based upon that, we can give these remedies. Impotence after frequent attacks of gonorrhea. Gonorrhea is non-existent right now, but you will have it in patients who are having multiple partners. Gleat with absence of sexual desire or erections. In female reproductive system for Agnus, we see there is leucorrhea which is transparent and stains the linen yellow. So what is the beautiful part about the remedies which are psychotic, and especially Agnus castus being one of them, very closely related to thuja and medorinum. All the discharges which excrete from the body or come out from the body are staining the body parts or the cloth which is nearby. This helps us to understand what sort of remedies we need to give in such patients. The leukorrhea will pass without any knowledge of the person, of the lady. Deficient secretion of the milk or suppression of the milk in nursing women. We see also very similar phase mentioned in Asafoetida, laccan, lac defloratum. Often with great sadness, say she will die. So, in the mind symptom, you will see somewhere the symptom mentioned by the patient that she does not want to live. She is so much fed up. There is so much harassment from the situation around her. On the physical body, you will see that she is a nursing mother. There is deficiency of milk which is not produced in adequate quantity, and the child is suffering. In those cases, we can think of Agnus castus. Agnus castus, Asafoetida, lac defloratum are very few remedies, which will act really well on increasing the quality and the quantity of the milk, and it is going to give good results provided you know when to give which remedy. Coming to an end, we have modalities. Caladium and selenium follow well. These are the two remedies which we will take up tomorrow. So, in cases of sexual weakness, if you have handled in your clinics, you will know that you will need multiple remedies to cure the problem. There is not one remedy that will help. You will need a series of remedies. And over here, when it is mentioned that after Agnus, you will require caladium or selenium if there is lot of weakness of the organ, so be it, and you can employ it in your clinics and find out the good results which follow very soon. You may also require to give medorinum or thuja. Those antipsychotic medicines or antisoric medicines can be sulfur. For example, in all cases of Baraitacab, I have always given sulfur, which has helped Baraitacab push to act well. Similarly, for Agnus castus to act well, you may need to give caladium or selenium to push its action into the body. So, this brings us to the end of today's session of Agnus castus from Alan's keynotes, and we'll meet tomorrow again the same time, which is 5:15 or 5:30, and cover two more remedies, which is caladium and selenium. So that's all for this moment, and stay tuned.